Well, good morning, everybody. How are things going? Morning. Morning, morning. How's it going? How's Canada treating you? We picked Canada and Ottawa because of the weather. I hope you appreciate it. So our goal this morning is to take a strategic look at a question that should be of interest to everybody in the room. Everybody in the room here, or most people in the room here, are innovators. But as we heard in the panel session yesterday morning, innovation is not an end in itself. You're doing innovation because you want to have impact. And between your innovation and the impact, there's a path to scale. And what we're going to focus on this morning is different elements of that path to scale and how you can actually move from a pipeline of innovations to impact, which at the end of the day is the results that we're all looking for. And that's really the core issue today. You heard it come up from everybody yesterday morning. You heard Trevor mention it. You heard Joe mention it. You heard Minister Fantino mention it. And this is not a surprise to anybody in this room, because you're driven to make a difference on whichever of the scientific tracks you are. The outcomes in global health are not what we want them to be. We need to have them better. And getting from here to there is innovation. And we're stimulating innovation with grand challenges. And that should include not just the small-scale innovations, but achieving impact. So to address that core topic today, which is fundamental to everybody in the room, we have a wonderful panel. And I'll just introduce them at the front end. This, to my far right, is Mario Marialdi. Mario's from the World Health Organization. And he's going to give us an example of a concrete innovation that we can think about as we're thinking about scaling impact. And in fact, he's already started to do it with the person to his left, who is Renuka Gadi from Becton Dickinson. And they're starting discussions about how this particular innovation, which you'll hear about in a moment, will scale. Wendy Taylor from USAID is to Renuka's left. And Wendy, of course, is a wonderful partner with Grand Challenges, Gates, Norway, UK Aid on saving lives at birth, which is one of the early funders of Mario's innovation, the Odon device that he'll describe. And Wendy will talk about how USAID is thinking about scaling, and she'll have some exciting news for us, working with Carol Dahl, who's here to my right, and Carol is the executive director of the Lemelson Foundation, and that is a very interesting foundation named after Jerry Lemelson, who invented things like the fax machine and things like that you don't associate with the name. But when you walk into Carol's office, you see all his patent numbers across the top of the ceiling, which is pretty cool. Phil Weilerstein is from the National Collegiate Inventors and Innovators Alliance, and Phil has lots of experience in bringing innovations to scale, and he'll tell us about that. And Wendy, Carol, and Phil will kind of do a thing together, which I won't ruin the surprise. Omer is with Grand Challenges Canada, but previously worked at the Acumen Fund. And Omer is one of the rare breed of impact investors in global health. He's actually written checks on behalf of funds using blended value, shared value. He'll talk about that, financial mechanisms to bring things to scale. To Omer's left is Rebecca Young, and Rebecca is, as is Toby, a great example of civil servants who can make a difference in our lives and in the lives of the people that we seek to serve. Rebecca is the head of the Development Finance Group at the Department of Finance in Canada. And Rebecca and her group have been involved in some very interesting innovations in terms of scaling, which she'll talk about, financial innovations that are very complementary to the innovations on the technology side that help things go to scale. Toby Nussbaum works for the Canadian International Development Agency. He's the head of the private sector group there. And similarly, Toby has been working on some very interesting innovations, and it's a good example of how a large development agency can take a crack at scaling innovation, at financial innovation for impact. And so you see the logic, and we'll just follow it. And we'll start with Mario. Our game plan this morning is we actually want to take about half of our time for a little panel discussion, and then half of our time for discussion with you. And so that's the idea. And there's no slides, and there's no speeches, and there's just discussion. So please engage and think about what you want to ask. Think about your innovation and the relevance of what everyone else is saying to that, and how that might scale, and what the barriers are, and how we can overcome them together. So Mario, you are the, I guess the right way to put it is the impresario of the ODON device. Can you just, as a concrete example, tell us the story of the ODON device? What is it? Where is it at? What are you trying to achieve? Over to you.
Sure. The ODON device, it's a new, simple, low-cost device for assisted vaginal delivery. And it is literally the first new concept, the first innovation in the area of assisted vaginal delivery in centuries. And at this moment, after the idea won one of the first awards, the Saving Life at Birth Awards of the Grand Challenges in 2011, and after that, we have moved forward with the testing. We have completed the first phase of testing in Argentina, which actually allows now to expand to 4 additional centers to test the device in women in deliveries with normal situation, with normal deliveries, and with prolonged second stage of labor. So the plan is moving forward, but what is particularly exciting for us is that today we are here with Renuka, who represent BD, which will be our industrial partner in this adventure. And this, I think, is particularly important because having an industrial partner makes the enterprise credible. We are confident that in few years, if testing will progress successfully as it has been so far, we will be able to transform a great idea in a great product. And I think also now is the time to think about procurement schemes, how actually we can bring this idea to the market, but in a way that it will be available for the people who need the most.
Great. And Mario, just tell the story. I think people will enjoy hearing the story of what is ODON, who is ODON, and how did he come up with this idea?
Very briefly, because it's a very interesting story which is behind this idea. And ODON device, the device is named after the inventor, Mr. Odon. Jorge Odon is Argentinian. He's, interestingly, is not a medical doctor, he's not a biomedical engineer, he's a car mechanic. He actually repairs cars in Argentina in his garage. And he had the idea of the Odon device by watching a trick that 2 of his young employees were playing in his business. They were actually challenging each other to take away a cork from inside the bottle without breaking the bottle. And they were able to do it by blowing some air in a plastic bag and being able to extract the cork. And he's playing this every time that you meet him, and he has done it already on TV on several international channels. But I think it's an interesting story, but it also shows how it's important to listen to people from outside our field. And great ideas can come from people who are not in our field, and I think our duty and our task is to bring this idea to the surface. And this, honestly, I always say this, and I don't actually miss one opportunity to say this. This was one of the achievements of the Grand Challenges, actually, to bring an idea from the mind of a mechanic in Argentina, bring it to a level. We have been already to 4 major scientific meetings, and we are now signing an agreement with a major company to bring this idea to the market.
Interesting. So just say flesh that out a little bit. How did the Grand Challenges help you extract that idea from, not extract, but take that idea from a garage in Buenos Aires or wherever it was in Argentina to the point you're at now? What was what was the role of saving lives at birth and of the grand challenges there?
I would like to say that, yes, the funding was important because it gave us the possibility, the financial means to do it, but most important was the visibility. Was really, I think, this is the perfect case in which we discovered an innovation. I mean, the innovation was there, was in the mind of somebody, he had a prototype, but had to be discovered and brought to the attention of the world. And this is actually what we achieved with the Grand Challenge.
And I think you explained what it was, just like taking a cork out of a bottle is putting a balloon over a...
It's a very simple plastic bag. I have actually the material I can share with you, and I have actually presentation and some videos for the one of you who are interested. But it's extremely simple. It's a plastic bag which is inserted automatically around the head of the baby, and then with a mechanism of traction, it allows for the expulsion of the head and the delivery of the baby.
Yeah, we picked this example. Obviously, we could have picked many more. Michelle McIntosh is in the room with inhaled oxytocin, et cetera. There's a lot of these ideas bubbling around. The question is how they'll go to scale and reach impact, Renuka, which is where you come in, potentially. So you work for a large company, BD. And what I'd be interested to hear from you is what led your company to consider this collaboration, especially, I mean, just take that question, but, you know, BD has not been in the maternal health segment before, but why would you do this, and what's in it for you?
It's a great question. So just for the benefit of the audience, I'll go a bit about who BD is. BD is a 115-year-old medical devices diagnostics company. We're headquartered in New Jersey, but with a global presence. And through the years of our existence, we've obviously have a deep institutional knowledge in terms of manufacturing medical devices and diagnostic instruments. We've brought forth to the market many first innovations. The first disposable syringe, for example, was a BD invention.
That's great. That's probably good enough. Thank you very much for that. And what I wanted to ask you is why would you do this?
And over the years, we never did anything in the area of maternal health. To simply answer your question, it was Mario Marialdi and Flavia who met with BD leadership at the World Economic Forum and talked about this potential device. And what struck our leadership then was just the impact of saving many women's lives, the fact that there was no innovation in this space for the last 60 years. And so we actually invited Mario and Jorge Odan to our leadership meeting. They demonstrated the wine and cork story, and Mario didn't mention it, but Jorge apparently woke up his wife at 3 a.m. saying, if I can take a cork out of the wine bottle, I can take a baby out of a woman's womb. And she gave him the meanest look and went back to sleep. And so it was a very fascinating journey of description. Now, I have to say it was not an easy decision. In a large company where you have multiple products waiting in the queue, to jump that line and say we need to invest in an unknown area with potentially an unknown return, it was not an easy journey. But I think collectively, because of the World Health Organization, their belief in this, and because of the fact that this actually was selected as part of the Grand Challenges Saving Lives, it gave us a new impetus. And we said if we're true to the mission of helping all people live healthy lives, we must experiment and go outside our home court, our comfort zone. And so here we are in a very advanced stage of negotiation, signing the deal to bring this device out to the larger market.
Great. Well, that's very exciting, and thank you very much, because it's going to take these sort of partnerships to actually have the impact we're all interested in. What I wanted to ask you is, what steps have you taken to make sure that the product will actually be affordable? I mean, presumably it goes in the hands of less skilled workers, and that's the whole point, which is you can broaden the base of who can actually deal with these problems in the field, but that also raises certain issues of affordability. How have you thought about that? And is this pure corporate social responsibility, or is this part of your business model?
Yeah. Again, we'd like to look at this as a sustainable business model and not as a CSR initiative.
Good.
Because we want it to last beyond. This is a perfect example of shared value, leading with addressing an unmet societal need, but in a manner that you can actually make some economic viability and profitability so that it stays on. Now, I spoke about the history of our company only for the reason to say that we have a core competency of being able to manufacture, mold that plastic into a friendly form. That's the only labor that we're very familiar with. And we wanted to take that core competency and design the Odon invention to be manufacturing friendly, easy, but at a cost point that is affordable, because we're very sensitive that this device can also be used in resource-limited settings, not just at the high premium end. And we know very well that cost is of concern. So going in, when we presented the business case back to the leadership, we actually took into account a different pricing structure for the resource-limited settings and a higher pricing for countries that can afford it, so that we present the true financials very early. And our strategy was looking at the UN Global Strategy for Women and Children and looking at the countries, the 49 countries that they targeted as countries with the lowest affordability but with the highest maternal health, maternal and neonatal instances. We looked at those countries and targeted a very different price formula for that setting. So going in, we're addressing affordability.
Excellent. So you thought about it up front, and you're committed to affordability because that's what you need to get to access. And we're all in this together. We have a shared interest in making sure this gets into the hands that people who need them. Delayed labor is a significant cause of the death of both women and children around the time of birth, one of the most significant. We heard yesterday there's almost 300,000 women who die, maybe 1.5 million children who die in that period, and this significant cause of that. These are serious issues. We're in this together. What can anyone on this panel do to help?
So again, that's a very important question, and I'd like to spend a little time answering this because I think the journey's just begun. We just have this deal. Invention has been brought to our attention, but the journey to accomplish and call it a success is yet to be undertaken. And just based on our experience, and there are many experts in this room, so if I'm preaching to the converted, pardon me, but based on our experience, we know that there is almost a magic formula for success when you're addressing products to resource-limited settings. I'll say that from our experience in developing the auto-disabled syringes for immunization. What you need to have in place is the right product. In that circumstance, we collaborated with PAC and brought forth this product. The right price point, to your very question on affordability, but the right policy where WHO in that circumstance took a position to say all childhood immunization programs that are internationally funded must use auto-disabled syringes. A right program, UNICEF, with the help of Gavi, created this entire procurement scheme to make sure that they get the best technologies at the best price and deliver it in the markets where there is a need, and right partnerships. And we would like to see that replicated with the Odon device, because in the absence of any one of these P's, I think this may not go forward. So what I call for and appeal for panelists here and in the audience is help us then actually realize the potential of this wonderful innovation. Let's work together to create what is that procurement scheme, what is that pricing strategy, how can we be a true partner in this journey of shared value and shared mission.
Great. So we'll come back to that when we get to the left-hand side. Obviously, they're not here with their checkbooks, but conceptually, the idea of taking an innovation and pulling it into the field is something we all share, and we'll think about how to do that. Now, we got a trio of Wendy and Carol and Phil, and this is and a little bit into Omer, where essentially now what you've heard is an example on the innovator side, on the impresario side, and on the company side. And now we're going to get essentially into some business development strategies. So how do you move from the point where Jorge Odon or Mario started to the point where they have the partnership with Renuka? What happens in the middle there? And how do we help innovators to do that? And Wendy, maybe you could start to speak to that with Carol. And as I hinted in the prologue, I understand that you have an exciting announcement to make about how you're partnering to help innovators like those in Saving Lives at Birth, like Mario, like Michelle, like the other 37 innovators that have been funded so far, to ensure that their ideas, innovations, inventions translate into products and enterprises that have a positive impact on the lives of those who need them. So Wendy, Carol, I'm not sure which one of you wants to start off, but maybe you could start us off on that.
Sure, and thank you. And it's great to hear the story here. This is really one of my favorite stories coming out of Saving Lives at Birth.
Well, it's an early success.
It is.
And it's amazing
Absolutely.
to think that 2 years ago you started a program, we started it together. Everyone always says innovation is on a 15 to 20 year time frame. Here we are 2 years later. It's not a success in terms of having saved lives, but you've actually tested it in women. You're getting the partnership. It's an important early marker along that process. So please carry on.
So just as a little bit of background, from the USAID perspective, we've really worked to step up our investments in innovations that can tackle those big, hairy development problems that we've yet to solve, and we're doing it through Saving Lives at Birth, through innovations such as ODON device, and we've got really a great portfolio of innovations that are showing great promise to be able to do just that. But we also know that the global health landscape is littered with lots of great ideas that just haven't been able to get to scale. And we've seen time and again that the rate-limiting step for many of these innovations is getting to scale. And you've got technologies that may work in a local setting. They demonstrate proof of concept. They seem great, but maybe they haven't thought through the manufacturing challenges at scale. They haven't thought through who their manufacturing partner will be, where the parts will come from, what they will cost to be able to do it at scale, what kind of distribution challenges they might face. Maybe they haven't developed a scalable business plan or thought through how to finance it at scale. There's a whole host of, even some of the policy considerations.
You've got us on the edge of our seats. What are you going to do about it with this person to
I'm
my right
there,
here?
So it's coming. But we really thought about these. These challenges are significant and they're complex. They are. They're harrowing challenges, and we realize that we need to be able to help these innovators be able to address these challenges and the magnitude of the challenges that they're trying to face with the magnitude of the health challenges they're tackling as well. And that's why, and there's the drum roll, USAID, on behalf of USAID and Lemelson Foundation and NCIAA, we're really pleased to be able to announce this accelerator program in global health. It's our Global Health Accelerator. And it's a program that's based on NCIA's long track record of providing training support to social entrepreneurs. And through workshops, through training, we're going to be able to help innovators. And we're applying this first initially to Saving Lives at Birth innovators, but this certainly has much broader application. You'll be able to help them get kind of skills and training they need to develop the right business plans, to think through the sales channels, the marketing strategies, what are the right pathways to scale, and to do it in a way that recognizes the ecosystem in which they're operating. And partnerships are important, financing is important. So really thinking that through, and you'll hear more from my colleagues here about this, but I just have to say we're thrilled to be partnering with these very knowledgeable organizations, and they've really been pioneers in the field here. So we're eager to get this going.
Great. And should we clap now or when Carol's done? Oh, we'll clap now. We want to start. Great. Well, thank you, Wendy, and that sounds great. And so, Carol, very cool organization that you've got there. Tell us about what competencies you're bringing. You've got a lot to offer. What are you offering? What's your side, and how does it look from your standpoint?
Great. So the Lemelson Foundation may be a little less familiar to you than certainly USAID and maybe Becton Dickinson and certainly World Health Organization.
Or even the Gates Foundation.
Even the Gates Foundation, right, or Grand Challenges Canada.
Could be.
But the long list ends.
Yeah.
So I would share with you that our focus is really around improving lives through invention. We were founded by Jerome Lemelson and his wife Dorothy. Jerome was one of the most prolific independent U.S. inventors. As Peter alluded to, he had over 600 patents, and his patents and ideas actually underlie many of the things we use today in various forms. But he believed very strongly that one needed to create a pipeline of inventors to create impact for the future, and that to do that one also needed to invest in the innovation process and entrepreneurship as a way of bringing inventions to impact with people. So, in fact, at the Foundation, we support creating the capacities in the ecosystem that will actually inspire and educate inventors, innovators, and entrepreneurs to take their ideas then and translate them into products that have impact on lives. So we also support the ecosystem that allows for the birth and launch of early companies and the translation into investable companies that others will pick up and take forward, and investable products and ideas that can be commercialized. So we're really excited about being part of this partnership because we feel that it's a real privilege to actually bring the kind of capacity that Jerome envisioned as part of our future and our mandate, and the kind of capacity we've been investing in actually at NCAA for over 15 years. So the National Collegiate Inventors and Innovators Alliance has the experience and the expertise to bring the capacity to help innovators in the USAID programs to actually translate their products into products that can have impact and reach people through businesses and commercialization. So we're excited to be part of that partnership.
Great. And what number should they call? Maybe it's Phil's number.
That's right.
So, Phil, what are you? It's a web address, so why don't you start with that, and we'll go from there.
NCIIA.org, although the program is accessed through this program. So the context of this, which Carol alluded to, is that we've got a almost 17-year history of working with very early stage technology innovators, inventors, and we do that in an ecosystem context. So part of the central construct is the notion of a team of innovators, a multidisciplinary team, what we call an E-team, moving an idea forward. And that was actually an invention of Jerome Lemelson, and really is the core around which we've built programming to help people who have good ideas very early on connect those ideas with the validating factors that enable them to move forward, and with the networks and connections and partnerships that we've heard talked about already. We've been doing this with university partnerships, and our focus is to not just work with an individual inventor, but to try and engage with them in a context in which they're surrounded by a network. So a lot of our work has engaged universities as kind of the birthplace of invention innovations, but to help the scientists, technologists, engineers to recognize that what they're doing is really just the very beginning of a very long process, and that actually thinking about the enabling factors in that process at the outset will make it much more likely to succeed and to be able to communicate the opportunity and the promise, not in the technical or scientific sense alone, but also be able to tell a story from the outset that relates to social impact, to market impact, and that actually has a connection and a framework in which that story is generated and that validates the opportunity earlier on than it might otherwise be.
Great.
So the training program is designed to engage the teams involved in saving lives at birth initially in a process in which they'll map out the way that they are planning to get their idea to impact and identify all of the players with which they need to engage.
How will you know you're successful?
Well, they're at the early stage through the ability of the team to actually articulate a value proposition from the point of view of different stakeholders, and to actually do that not just from a we think, but we have talked to and we know. And so those knowledge points of whether it's a price point that needs to be reached, or information about the distribution context that you're going to have to work within, or some of the regulatory or intellectual property frameworks, the earlier that those things begin to influence the development of the technology and the factors that will enable the partner who you work with to understand the promise and to be able to translate that into their process.
Great. Now, you've had a couple of successes in NCIAA. Tell us in a just 10, 15 seconds.
We've had quite a few. Yeah.
Let's
so
pick
in this
one.
particular
Give us
space,
the best example.
well,
an example.
An example that I think is quite relevant here is a company called Sproxel, which is working in mobile health. They've developed a system, very straightforward for the user to validate a pharmaceutical package from the package. It's an SMS-based system, but the technology behind it is actually very advanced, and their value proposition relates to pharmaceutical companies, the mobile companies they work with, public health agencies, and the interesting thing about this is that they're having that impact very quickly out of the gate. They've been doing this for less than 2 years, have over 1 million users around the world, expanding very quickly. But they also have created a kind of unique perspective into the pharmaceutical distribution chain, which previously didn't exist. And that's kind of an added benefit and layer that they were able to achieve because they saw that as one of the value propositions that was critical to create.
Great. Thank you. And let me ask you guys the same question. Very exciting announcement. We know the website to click. What does success look like for you?
Well, I think from the Lemelson perspective, it's really about how one takes ideas, which there are lots of ideas, but actually translates them into impact. So it's going to be that the products that we actually see coming out of the programs, such as USAID, translate into the countries and actually have a life and existence there that goes beyond the investments that we may be making directly. So we actually focus on that not only with NCAA, other programs we have actually in the countries to create those sorts of capacities.
Yep.
The end success is products reaching people and having impact on
And just
lives.
in 1 second, because it's it's a bit tangential, but those are pretty cool, your incubators. Just say a word about those and how this
Nice
connects
of you
with
to
those.
think so.
Yeah.
So we also support capacities in country that are similar in some ways and tie very closely to the kind of work that NCAA does in terms of promoting new ventures coming out that are going to address the needs of the poorest in the countries. So they work with investigators from those countries to actually help with mentoring, creating networks, providing the beginning funding for the initial companies to get off the ground and become investable companies for the future. And so those are called ramps. We have our major programs in India, Indonesia, and Peru. We've been learning from those. But examples are that they nurture not only the country-led programs. So, for instance, in India, Vilgro nurtures Indian-led companies that are focusing on the needs of the poor, as well as U.S.-based companies that have come in. And a nice example of that is actually a company, Promethean Power, which came out of NCAA training, moved over to India, actually required the in-country assistance. And so they can play a bridging role as well from this world to that world in terms of getting people to the point of being
That's one of the
investable.
things I want to pick up with Omer. But I'd like to think that people in this room who are innovators from or innovating in India, Indonesia, and Peru could actually access your ramps with some of their ideas and see if there's some incubation there that could work.
I think there's tremendous opportunity for that. And I think there's opportunity also as new organizations arise. We're seeing some of the programs we work with who've been involved in figuring out how to do distribution to customers, creating new laboratory environments in the context of the customers to ensure the next generation products come out. Examples of that are, for instance, with Selco in energy and also with IDE India in agriculture.
Great. Wendy, I'm just going to turn to Omer for a second, and then I know you've got an accelerator center at USAID. It would be good to see how that fits in, too. Maybe we'll go back and forth. Omer, so you heard Phil talk about not only the science and technology, but also you talked about the business markets, you talked about the social aspects. Is that ringing a bell that you'd like to say anything about?
Sure, absolutely. And I think, Grand Challenges Canada has really embraced an integrated innovation concept where we're firmly convinced that you will need a combination of scientific, business, and social innovation to really take these projects to scale. Because even if you do have the scientific know-how, figuring out the problems of marketing and distribution and getting it to the places that these products need to go are sort of enormous challenges in of themselves. As a result, we in our Rising Stars program particularly, and also in our partnership with Saving Lives at Birth, are really looking to engage a wide range of grantees, from technical innovators to social entrepreneurs to business entrepreneurs. We're also engaging a wide variety of stakeholders in helping us to scale these initiatives up. And so really are looking at governments, at foundations, at private investors to help us and collaborate more effectively in taking these projects to scale. A recent example that comes to mind is one of our rising stars. It's a point-of-care CD4 testing device, and they were looking for more capital beyond the initial grant that we had made. And so we held an angel investing event in Toronto this October with an angel investing network there called Maple Leaf Angels. It was a very successful event, and the company was able to raise $750,000, which we'll be looking to match as we go forward towards their Phase 2 grant.
And was it just the money they got, or did they get any guidance from the angels in the room, thinking about the skills needed to go to scale?
Absolutely.
Phil was talking about that too.
Absolutely. I think from our perspective, that's just as valuable as the funding, because we've got enough funding on our side that we could have, in fact, given them that money itself. But what we're really looking for is for the venture capitalists in that network to work with the entrepreneur, with the scientists really who don't have that business background, to take that project through sort of the marketing and distribution challenges that are going to be. So one of the angel investors, who's a very successful young entrepreneur in the mobile space, will be joining their board and will be serving as interim CEO, if you will, while the company ramps up.
It's a great example. Now, I understand that you have a friend who has an announcement
Yes,
that's relevant to everyone in the room as well.
Absolutely. So we've been working on really trying to help not just our innovators, but also really open it to the field. And so we've been working on an online proposal development and scaling up resource. And I'd like to ask Jocelyn Clark, who's been leading that work for us, to actually make the announcement.
Is this microphone? Wonderful, thank you. Very interesting session. So thank you for including me to make an announcement to you all that Grand Challenges Canada is very happy to announce today that we have created on our online proposal development resource a set of resources to help people plan for their innovation to go to scale and to have impact. And in particular, to help you communicate that plan, that path to scale in more business environments. So we really recognize that many scientists and researchers could use support and resources to really think entrepreneurially about the global health problems that they're addressing and their solutions. And this is whether your innovations end users are in the private sector or the public sector. So at Grand Challenges Canada, or grandchallenges.ca, you can find a link to our proposal development resource, and we encourage you to access it, to share it with your colleagues. It's freely available to anybody to share, to download, to disseminate. And we hope and plan to build on this resource as we work with our other colleagues in this space, and we very much invite your feedback as to whether it's useful for you.
Great. So, Jocelyn, they clapped for Wendy. Should they clap for you, do you think? I thought so. Now, Wendy, let me just turn back to you, because I think this is very relevant to the people in the room. What I see developing is something very exciting. A space, as you said, we didn't pay that much attention to before. It's critical to have innovation with impact. And we see some great product offerings developing. The fantastic announcement that you three made, the online resource, the Angel Network, and we're trying different things, and I think that's fantastic. And because of the Grand Challenges approach, we're all doing it together. We're not duplicating, but there is a little necessary redundancy that's good, and we're reaching out to different people, and we're sharing lessons. So how do you see this sort of environment of different ways of trying to do that with the same objective, learning from each other, and how does that fit into your accelerator center, et cetera?
Sure. Well, I think it's really exciting, and I view this as pieces to a puzzle, and we think we know what the puzzle looks like, and we know what some of the pieces are, but we're still trying these things out. So having kind of different approaches to what is a very difficult problem is really important, and understanding the kind of skills needed, understanding how to write the right proposals, understanding how to learn from the peers, understanding how to access the financing, and partner appropriately. All of these are really important pieces, and we're trying to think about how best to bring them all together. So I think we're going to be learning quite a bit in this space as we go forward as well, and we will be sharing our learning together as partners, so that I think we'll continue to get smarter. But this also fits in really nicely with the work we're doing. Earlier this year, we launched at USAID our Center for Accelerating Innovation and Impact, and so I've been spending this year starting it up, and I'll be leading this new center, and it's really focused on some of these same ideas, but thinking about how we can, and this is really a center of excellence within the Global Health Bureau, and think about how we can do a better job accelerating not just the development of these innovations, but accelerating their introduction and their impact and their scale up in the field. And we're doing it by bringing in business thinking, understanding of market dynamics, understanding of how to shape markets, understanding what are good business practices, and taking that learning from the private sector, taking that learning from academia, and bringing it together to help us continue to get better at scaling up the tools that we're continuing to create. And we know that we've got a lot of great tools out there already, and they're not getting utilized to achieve the impact.
And what's good is we've got some concrete places for anyone in the room can go to one of these places and get some help on the path to scale. And that's what I was trying to get to. So where are we at? We had a concrete example, first two folks. We essentially tackled the issue of business development, or developing ideas on the path to scale to some extent. Now I want to shift to the financing side, and that was already implicated a little bit. But just before going to Rebecca, Omer, I want to ask you a question. You are a pretty unique person in the room, because you actually have the experience of having co-managed a fund that made impact investments. You've written checks, you've evaluated companies. What is the main lesson you learned as an investor in the social space in global health?
I think some of the main lessons that I can draw from my experience is, one, you do need to be patient. I mean, it has to be patient capital, the time horizon to realize an exit not only on the financial return, but even on the social impact is fairly long. And I think you have to appreciate the horizon in order to not get disappointed by the many challenges you face. And you also need to have an appetite for risk-taking. Interestingly, actually, Sproxil that Phil mentioned was the last company I invested in when I was at Acumen, and was introduced to me by NCIIA. But at the time we invested, they'd done one pilot trial in Nigeria, and for us to sort of, I think the technology was world class, and it was really the passion of the entrepreneur that convinced me that this was a viable bet, and I'm gratified to hear that it's doing very well.
Great, thank you. And so now we've been, in terms of financing, we've really been talking on the push side. We've been talking about angel investment. We've been talking about something like the Acumen Fund that's investing in social enterprises. But Rebecca, feel free to go back to push if you want, but you guys have done in Finance Canada some extremely exciting experiments that are starting to pay off with other partners in the room on demand-side pull financing, and you actually hinted at that, Renuka, when you were talking about procurement, which can be even a more powerful force on the pull side than some of these push mechanisms. Tell us about, the record there, the pneumococcal market commitment, ag results. Anything you want to say about how this looks from a Department of Finance, and why a Department of Finance, which is government dollars, would be interested in this path to scale financing innovations, and how do you do it on the demand side?
Well, first of all, I heard from a number of you, including yourself, Peter and Wendy, about this concept of shared experimentation, and I also heard about harrowing problems, challenges ahead of us. So with putting those two in mind, I think the approach that we've taken at the Department of Finance is that these are harrowing and critical problems, and so we have to try everything. We need a large toolkit to address these challenges from multiple ways. And so really, with an approach of shared experimentation, we're trying innovative financing mechanisms to achieve the types of partnerships that we hear. And so certainly the demand side or the pull side is one type of experimentation on how to make that happen. But I always, when I talk about pull mechanisms or pull funding, put the caveat that push funding is critical, especially for basic R&D, and so I never want to confuse those messages that there is a global public good of push funding to establish this body of knowledge to draw from. So what we've essentially done, but it's not a panacea. There's no panacea or a magic bullet that is going to magically pull together the partnerships and the financing that are needed. So over the years, we've tried a number of different approaches with so-called pull mechanisms. And essentially with a pull mechanism, what we are doing is we are defining the outcome that we're looking for, but not the means to it. We use experts in the fields to define what those outcomes should be and what does success look like when you achieve that outcome. And we also then try with sort of a quasi-art science to figure out how much should we pay for that outcome, what would both be the sort of the production or the manufacturing hurdles for the innovators, but then also sort of triangulating what would be the social welfare created as a result of that innovation. And so we define the outcome and how much we're willing to pay, and then we essentially let innovators define the means, and define the means both in terms of the technological means and in terms of the partnerships that would need to be established to essentially chase after that prize. So you mentioned we've done this work in vaccine space with a pneumococcal vaccine. We defined the price that we were willing to pay for a pneumococcal vaccine with very specific criteria to meet African markets. We've since had 2 pharmaceutical companies come forward to claim part of this advanced market commitment. More recently, last June, our Prime Minister Harper, along with leaders from the UK, from US, from Australia, from Gates Foundation, put up $100 million in an initiative called Ag Results, which is essentially to test drive some later stage innovations in food security and test drive it from a development impact and also a commercial sustainability. So, to Renuka's point about, a corporation when they're thinking, do I or don't I invest in this innovation, what we're essentially doing is removing some of that market uncertainty that you alluded to by providing a temporary financial incentive to hopefully alter your risk-reward calculation and come up with a decision, yes, if it looks like an investable or if it needs sort of some patient capital, as a government we are providing that. I'll just say one other unique point about this sort of pay on results approach is that we're not only defining the outcome in terms of a technology, but we're also linking the payment to actual adoption. And so we want to ensure that we're not just creating technologies that sit on the figurative and literal shelf, and we want to create the incentive that the innovators get out into the field and they're speaking to the users, they're speaking to, to address the constraints and the preferences, and also be thinking about the partnerships that are needed to actually get it into commercialization, get it into the field, get people buying or using the new concepts or innovations. So I guess with that, it's one mechanism to try to achieve this, and we I think that we certainly are in the spirit of experimentation interested to hear other ways to do that.
So just as a concrete example, and not looking, this is a commitment, it's just an example, but just so I understand it, would this be the ODON device in the hands of a midwife you would pay X dollars for? Or how would that work?
Yes, it would be. I mean, we would, with the ODON device, we would be essentially, if we determine the value of it, what is the appropriate affordability? We may decide, and I'm not sure whether we're talking $100, $1,000, but let's say we're talking, $1,000.
Let's say 100.
100, okay.
Yeah, don't give her any ideas. Let's say 10, and then she can bargain us up to 100. Let's just use 10 as our example.
Well, that's a good example. Let's say we do want it to be 10, but we realize that Renuka's company cannot convince her CEO to make the upfront.
So let's make it 50.
I like that better.
No, here's how it worked. Let's say that 10 is what the development experts are saying is the affordability. Let's say that Renuka's CEO is saying, well, for me to build a facility and for me to do the final stage R&D and production tinkering, I'm going to need at least to sell, 10,000 units at $100. And so what we would do as donors is essentially, first of all, we wouldn't pick BD. We would say it's open to anybody. But for a period of 10,000 units, we're going to provide that 100 minus 10, the $90 subsidy for 10,000 units, and then let a corporation or other innovator make that decision. Are we going to ramp up and collect that? We would then get our lawyers involved, and we would get BD, when coming to claim the prize, we would get them to commit to providing a tail $10 price once they've gotten over that initial hurdle.
And Renuka, you're nodding. Is that the sort of thing you were...
This is like music to my ears. I wasn't expecting this level of detail on a panel, but...
It's just an example. Don't get too excited.
It's a good example.
You got to show that the thing works first, too. There's a little step there. But
it's a good example, I'd say.
Great. Okay, good. Thank you. So, Toby, let me thank you very much, Rebecca, and for really making something that can be hyper-complicated. I'm sure there's hundreds of people in this room who, for hundreds of days, have never understood what a pull mechanism is in finance, and I think you just totally clarified it for everybody. So thank you. And again, congratulations on your leadership, personally and in the finance department and our finance minister in terms of this area. Toby, you got a really interesting job at CETA. We heard from your minister yesterday. It's a big development agency. It spends about the same amount of money or a little bit more as the Gates Foundation every year. So it's a sizable player, and you're looking at innovation. You're nesting that in the concept of economic growth, which is very exciting because for reasons that maybe you'll discuss rather than me. Tell us about your thinking about this and maybe draw some synthesis of what you've heard as well and how that relates to the directions you're taking.
Sure, thanks, Peter. I mean, in some ways there's an advantage to going last because you can glean all of the great ideas. And so I would say as a donor agency, we see our responsibility to try and catalyze innovation. We don't think that we necessarily have the goods to be the innovators ourselves within the four walls of our building. So we do that in three ways. We think a lot about the types of partnerships we can build to do that. The minister announced yesterday that we're working much more closely with you. We work with the Gates Foundation in many ways already. That's one example of the expansion of our partnerships. We also are working hard to expand the partnerships with other donors. So we have agreements with a number of them, including increasingly with emerging donors, with the Brazils and the Koreas of this world, who are playing a very important role in terms of drawing lessons learned from their recent extraction from serious poverty. And so those types of partnerships can be very helpful. So that's one area. A second is we're trying to do a lot more in the area of innovative finance. Rebecca spoke about pull mechanisms. We're also looking at other results-based mechanisms that we can think about and implement. A couple examples, social impact bonds.
So just what is the difference between a pay-on results and a social impact bond?
I would say the difference is you're establishing in a social impact bond essentially a contract with a third party to achieve certain social objectives. And it's very interesting because what you do is you set a price. Can we use the $10? And you say to someone, we will give $10 to someone who can make some headway in terms of reducing a social problem. If you exceed the target, you'll get more money back. If you don't meet your target, sorry, we're not going to pay you. And the advantage of that is twofold. One of them is it incents other people to help you solve those problems, which is what we're talking about on this panel. And the second is, and this is important, I think, and Wendy may have some comments on this too, but risk is a difficult thing for government. I mean, we're trying to do that. We're trying to be more risk-taking, but ultimately, these are public funds, and we have to be careful in the way we manage risk. I think risk is easier for private corporations, for foundations. But in our system, when you have a minister standing up in the House of Commons every day, it's hard to explain failure. It's easier for you to explain failure. So that notion of sharing risk and contracting out risk, I think, is very helpful, and that's what the social impact bond is
And it
all
also
about.
leverages other people's money. So it's not just the money in government coffers, it's foundations, high net worth individuals, et cetera. It's an amplifier effect. So it would not just be the governments of Canada, XYZ, paying X dollars for the ODON device. It would be them plus people who are interested in doing that.
Absolutely.
Like some of the people in the room here.
Yeah.
Could even be investors.
Yeah.
To get big social returns. Save lives.
Yeah, absolutely.
And
Let
get
me
some
just
money
mention
back.
the third area that I think we are moving into, and it's interesting because I have a big sign that says Grand Challenges behind me, but challenge funds and the notion of competing for donor dollars is becoming, I think, increasingly the model. And we're doing that, obviously, in our work with you, but we're doing that in other ways, too. There's a very exciting area in research called systematic reviews, which probably many people in this room are aware of. But the idea is you put tough questions out for tender. So you say, how do we increase agricultural yields in places with low rainfall? You put that question out. You say, I will pay $10 for the person who can solve that problem or who can give us some kind of evaluation of the research that's out there.
Might even be a mechanic in Buenos Aires.
Exactly. And so I just think that notion of being inclusive, taking crowdsourcing type principles, trying to draw people into development who don't see themselves as development actors, but actually have a lot to offer in terms of solving the problems.
Great.
That's the objective.
Fantastic. So thank you all very much. We've still got about 27 minutes left to open up, discussion, draw people in. So please, head to the microphones, ask your questions, make your points, and we really want to have an engaging discussion. And I think what we'll do is we'll take 3 or 4 points. Or actually, let's just see a show of hands. Who's got a question or a comment they want to make in the next 27 minutes? Just raise your hand. 1, 2, 3, 4, 5. So if there's 8 or 10, because they always come out of the woodwork, which is great, let's just take 2 or 3 minutes per question and response just to do the math. So Michel, please go ahead.
Michel Bergeron.
And if you guys want to take note, because we'll take 2 or 3 at a time, and then yeah, go ahead, Michel.
So Michel Bergeron from the University Laval in Quebec City, Canada. I found out throughout my experience of transferring research into products that, in fact, we are extremely good in evaluating research projects. We have a lot of experts. But when it comes to inventions, discovery, we are very poor in evaluating them. And this is a major problem. I was very fortunate in the 90s when we were the first to show that we could identify using DNA microbes in less than 1 hour instead of 2 to 3 days. And I created a company. And my luck was that we were evaluated by 2 outstanding experts, one from Boston and one from New York. But before that, we had been evaluated by a lot of non-experts. You see them when they ask the question. And finally, we were very successful. And we put a lot of products at the approved. But my question to you is, have you thought about uniting yourself, the different Grand Challenge Canada, Grand Challenge US, all the other organizations, in pooling a group of experts that are very good in evaluation? There's always a risk, but today the problem is that the venture capitalists, they will invest, if they have $100 to invest, or $100 million, they'll invest a little bit in each project, hoping that one will be successful, instead of having really experts that, they'll make mistakes. But if you have a group of experts that really can evaluate properly technologies or inventions, I think the success would be much greater. And there are not many experts, I found out in my experience. And so that's what I'm proposing or suggesting or asking you. Have you thought about that?
Thank you, Michelle. We'll address that in a second. Please, go ahead.
The Bill Gates Foundation and the Grand Challenges initiative is open to the whole world, and I appreciate that what you've said is true in terms of scaling up, and is true for the United States and Canada, but to what extent are the organizations you're representing open to other parts of the world, and if not, how are you going to do scaling up for those inventions?
Good question. Anne?
Hello, my name is Anne Enderman. I still have a little laryngitis, so I hope you understand. Thank you for a very exciting session this morning. It was really very interesting. And I have a question regarding the innovation, because our innovation is not a vaccine or a drug or a device, but rather our innovation is a training package for frontline health workers in especially low-resource settings, but could be globally, to actually not only put Band-Aids on every time someone comes with a health problem, but to understand the underlying social problems, the social diagnosis, because these things are so closely linked with the health problems, and to help also do referral and advocacy to have larger social change and change the social environment so that these problems don't recur. So what kind of lesson or message is there for people like myself who do not have a product as such except for a training package? Do I need to develop a company that then gets listed on the stock market? For instance, another equivalent is the MH-GAP. We heard a lot about that yesterday. It's a training more clinical than what we're producing, but a training package for frontline health workers to treat mental health problems. And so what are the different mechanisms or differences that people in our situation should be looking to help fund and scale up, because there's still issues, these different types of products?
That's a fantastic question, Anne. So let's just take those three. Gus, are you okay to hold on just for a sec? And then let's just take those three. Let's go backwards order. That was a great one, which is not everything is, a product ends up in a company. They're very important services that might have to do with human rights and related to child labor in internally displaced persons camps, like Anne's innovation, for example. And we want to scale that too. We don't want to just scale there. You have to think about different channels for scaling. And Toby, you're doing the most nodding, so do you want to lead off?
Well, just to say, I think the answer is that's why there needs to be public funds prepared to take these types of ideas to scale without necessarily the help of private investors. And we've been very clear that, in fact, that might be the niche that we fill as a development agency to occupy the space that no one else is willing to occupy because of that social purpose.
Perfect. And yep, go ahead, Phil.
So, I think that's true. I would also say, though, that part of it is also about how you're thinking about and what you're taking responsibility for in developing the innovation. In other words, it isn't a product that you're putting in a neat package, as you might a device, but thinking about the value proposition for the users and thinking about them as consumers of the good that you're creating actually will help you to figure out how you go to scale with it. Where the capital comes from to scale it up may be different, but in fact, you're looking for the same thing, that you're providing a solution to a problem, that you have a story that makes that very clear to both the users, consumers, as well as the people who are in the supply chain to provide it.
Great. And now let's go to the middle question, which is other parts of the world. Omer, do innovations come from everywhere, and are you interested in scaling them wherever they're from? Or?
Absolutely. I would say when I was at Acumen, we in fact put an emphasis on people who are building businesses in the geographies that we were interested in, because we knew they were going to be there for the long term. They had the networks in place to actually build their businesses successfully. And I think we've actually done the same thing at Grand Challenges Canada, where we really do have an emphasis on getting innovations from low and lower middle income countries. And in fact, our current round for that proposal is currently in place until February 4th. And I do encourage everyone both to take a look and see if either your innovations might make sense, or if you know of other people in those countries who could apply and actually increase the pool of applicants that we have.
And also the scaling in the local environments you spoke to when you talked about your ramps, essentially.
Right. So I think there's also a need for capacity in country to actually help people take their business model to the next step, to actually engage directly with the consumers they're going to be working with. It's fine to sit here and look or go visit for a month or two or something, but to actually be in the field working with consumers every day and getting that feedback is essential, just like it is for companies here in the U.S. or in Canada. And so I think that there are capacities out there. We certainly support some of them. There are other capacities, and it's important for you to think about what the path is to actually engaging directly in the countries, to find the markets, to actually find the value proposition, and to work with the consumer to create a viable entity for the future.
And Wendy, I'd like to build on those, and maybe you could incorporate what you're going to say in this question to the first question that Michel asked. He essentially said, look, a bunch of you are creating pipelines at the $100,000 to $250,000 level. We get the idea that that's a pipeline creation. But then when you get to what we've been calling transition to scale at the $1 to $2 million level, whether it's a phase 2 Grand Challenge exploration, whether it's a transition to scale in saving lives at birth, whether it's the phase 2 in the STARS program, Michel is asking how we're really going to evaluate those things, not only on the science, but on these scaling issues, whether it's in a public or a blended value channel, to Anne's point. How you're going to evaluate them? Are we going to get that evaluation right? How can we learn? How can we learn from each other? How can we do it with each other? It's an excellent set of questions, because if it's just purely scientific peer review, without thinking about the impact issues, the business issues, the social barriers, the scaling things at that level, it ain't going to work. And I think that's what Michel was really getting at, plus the commercial issues. So any thoughts on that, and then fold in whatever you were going to say earlier to that?
Sure, and maybe I'll just do the other thing quickly, and just to add to Carol's point about the in-country work. We're actually holding our first workshop with our Saving Lives at Birth innovators in Tanzania in January, and doing it there in part because that's where many of them are working. Some may not be local organizations, but they're working there. Others are actually country-based organizations that are actually developing country innovators themselves. And by doing it there, we're actually able to bring in local experts, perhaps bring in local
But on
financing.
evaluation, we're just short of time.
All right,
on evaluating?
but on the evaluation, I think it's a really good question, and it's something that we've been spending a lot of time thinking about. We need to get smarter at evaluating what ideas can scale. So as we are sitting down and trying to pick those groundbreaking innovations, trying to make sure that we're not just looking at what's working, but
so
how are
we
we doing? So part of it, I think, is continuing to assess as we look at our portfolio and we see it progress, what's actually working, what kind of problems did they have, and look back and say, could we have seen that? Are we asking the right questions in the beginning in terms of scalable ideas, the right business plan? So we've got to continue to look at ourselves and how we are evaluating what's scalable and whether we are picking the right ideas. And so I think it's going to be a continual learning process.
Okay. And Renuka, what advice do you have from your perch? I mean, this is what you do for the groups of us who are in the process of doing this, as Michel was.
Right. I think Michel's question was really, I'm still thinking about it, because I'd argue that you'd need experts through the entire phase, starting from the beginning to the end.
Yes.
Experts who can look at the impact of the innovation and not just the financial return, because that, I guarantee you, we have plenty within our organization, right? So you need experts such as Mario, who have the knowledge and the conviction as to why it will work. So you need that experts. You need experts who can shape market, bring in the market dynamics into play, to train frontline workers, as was raised, because it's a whole continuous process. And I just think that comment is very powerful. I hope we can come back in the coming years to sit down and actually discuss a start to end of how we engaged experts throughout a process to make an innovation succeed.
Elmer?
Yeah, I mean, I definitely think, I think we're still learning in terms of evaluation, especially we've funded a lot of projects at the sort of STARS level, and I think we are still learning at the scaling level. And I will say, when I was in venture capital, we probably did have a higher level of due diligence on some of these issues. As an example, Sproxil that we mentioned before. I talked to the management team, to the board. I talked to the head of the Nigerian FDA. Refused to believe that I had talked to the head of the Nigerian FDA till I met him in person. Talked with companies in India and Pakistan, pharma companies, markets that they hadn't yet explored either, to see actually if the innovation would be successful. And I do think we need to bring some of that into the evaluation process where...
Of course. But to Renuka's point, you do that up front. You have venture capitalists at the front end.
Yeah.
And Carol, I just want to get a quick point. Then we're going to take 3 more questions. And believe me, whatever you're going to say, you can fit into one of the things that these guys are going to ask. Carol, just quickly. And then,
my quick point is actually a little bit of a summary of a couple things said here. One is, Peter, you made the point, which I definitely resonate with. You have to look at things in 3 levels, right? One is the science, technology, innovation that's underpinning it. The second piece is the social part. And the third is the value proposition that's going to allow you to take it down the innovation chain to become a self-sustaining product for the future. So you need to begin that evaluation as soon as is reasonable on all 3 counts, and I think that means once you get to sort of proof of principle of the science, you have to start thinking about the other 3 things. And what that means to me is that those of us who are funders need to feel responsible for structuring the way we fund in a way that prepares you, who believe you have solutions, to actually be ready for that next stage of funding, because the questions are going to get harder and deeper on each 3 of those areas as you go forward. I think for the grantees who are out here, you need to be prepared for the fact that those are the questions that are going to be asked, and they're not unreasonable questions, because without them, you're not going to succeed in getting things out there.
That's a nice synthesis. Gus, please.
Gus Nossel from Melbourne, Australia.
Gus is my hero, by the way.
My question is for Rebecca, and it relates to the conundrum of the shifting sands of scientific discovery. Rebecca, you've got up your sleeve $1 billion for an advanced market commitment for the pneumococcal vaccine. Great, biggest killer of children in the world, the pneumococcus. However, while you're rolling that out, while you're building new production facilities with 1, 2, or 3 companies, and getting ready to deliver a 7-valent or a 9-valent or an 11-valent vaccine for an organism which, however, has about 100 serotypes that cause pathology. While you're doing that, I'm beavering away to create a better product, namely a common protein vaccine which will cover all the serotypes. And of course, I may well be doing that with other companies, not the ones for which you've just built a new production facility. And I come around with shifting sands of scientific discovery, a better product. Where does that leave your $1 billion?
Good. So just hold on to that question, Rebecca. It was nice, focused. Good question. Thank you, Gus. Stan?
Stan Slotkin, Hospital for Sick Children in Toronto. Peter, I have a question about timing. Yesterday we heard from a number of MD PhDs about their incredible work. The last speaker yesterday talking about the human biome, phenomenally sophisticated concepts. It's unlikely that we would ask the businessmen on the panel to become scientists. On the other hand, this morning I heard from the panelists phenomenally sophisticated discussion around what it takes to scale something up. Yet you are asking the scientists to take on the role of scalers. The pendulum has swung. The old bad old days, scientists would be in their labs and they would say, I'm going to invent something, and someone else is responsible for taking it to scale. And now, Peter, of course, what you're saying is that not only do you have to invent something, but you, Mr. Inventor, Mr. Scientist, are also responsible for taking it to scale. I wonder whether that's the right approach, Peter. There hasn't perhaps been enough discussion by the panel on partnerships. There's been too much discussion perhaps on training. And I think maybe it's inappropriate to ask a scientist to become the scaler, as inappropriate as it would be for the businessman to become the scientist.
Great question. Thank you, Stan. And Alan?
Thank you. I've enjoyed this panel. I really recommend my question to Trevor and Rebecca. We have a wonderful new copper mine by First Quantum going in a poor part of Zambia that I know very well. And they're going to hire a lot of people and bring wealth to that area. But I'm just wondering how the government of Canada can facilitate this company, which is going to have a lot of corporate tax revenue that is going to be valuable to our to Canada as well as shareholders. And how can we facilitate this company to do something not only just in the regional area that will improve health and education, but really help the government of Zambia and its sustainable structures like education and healthcare and ministries that supervise these areas to really create the middle class that Zambia needs to be a successful country. And I think that we have an opportunity as one of the largest sources of mining capital in the world to really help these companies do something more in Africa than what they've traditionally have done. Thank you.
Wow, those are three great questions. Phil, why don't you start with the scientist, business person, scientist, and I wasn't really saying they had to do it. I was saying that I think people all care about impact, and there's different paths. But
yeah, and
you must have some thoughts on that.
I think
that's
that
a great question.
It touched a nerve. It is a good question, and I think it's worth talking a little bit more about. So the expectation is not that the scientist becomes the businessman, but rather that the scientist can communicate with the business community as well as with customers and other users. And so that's really where the focus of it is not to become a business person, but rather to understand how to think like a business person and to speak in terms of the ideas and context that will enable them to then take action.
Well, what about the idea of a handoff, which is what
So
Stan
the
was really
handoff, you know,
asking
the most inefficient form of handoff is tossed over the transom. And that, unfortunately, has been the traditional path. And the assumptions there are on both sides that I'm doing the hard part. And the reality is the whole thing is actually quite difficult and requires a real partnership. And so what we're focusing on in the accelerator training is equipping the early stage team with the tools to be able to engage with the partners that they need to and be able to explain what they're doing in terms that relate to those partners' problems, not to my really cool, shiny discovery.
And Omer, one of the things that struck me, and this is really cross-fertilizing Stan's question with Michelle's question, one of the things that has struck me is the further out you get, or the closer you get towards where the challenge is scaling, the more you're actually focusing on the person in addition to the idea, and that goes right to Stan's question. Talk a little bit about that, and there's a variety of people. Some scientists will want to take it all the way, some won't, and let's just unpack a little bit the variation underlying Stan's question. I think it's also relevant to Michelle's question.
You know, I mean, I actually do think that is a great challenge. You know, how do you take sort of the scientists to be able to successfully commercialize the business? And I wouldn't say, I'd say there is no easy answer. While, you know, I'd love for all of our grantees to be like the Google boys or Mark Zuckerberg, you know, in reality, that's pretty unlikely. And I think equipping them with the tools, sort of what NCIIA is doing with USAID and the Lemelson Foundation, we ourselves are trying to create a local angel investing network and incubation ecosystem in Kenya and perhaps spreading that out regionally. So I think they're sort of part of the solution. They're never going to be the entire solution, and a lot of it is going to come down to the individual, whether they have the drive or the passion to take that idea to scale, or recognizing their own weaknesses, find other people who can actually help them accomplish that. I think it's a difficult problem, but one that we're hopefully able to solve.
And I got to keep going, Carol, but I'm just wondering, Mario, you haven't come in yet in the responses. You picked up an idea of a car mechanic inventor. You're from WHO and you're an obstetrician. You're now working, I mean, where do you come in and when are you going to leave and how are you going to hand it off? Just as an example, but quickly.
Yeah, when I was listening to the question, especially the question about the role of the scientist, because I'm trained as a researcher, I remember that yesterday when I got on the cab from the airport, I shared the ride with a colleague from Zimbabwe who I think is in the room. And in the few minutes, the discussion immediately centered on the issue that we are both researchers, but we have to understand the business community if we want to move our ideas forward. And I think we have all to realize that what we are doing now, and I thank you and all the Grand Challenges community for this, it's really a paradigm shift. We have been trained in a business model in which we had an idea, we were applying for a grant, and then we will come out with a publication, and that was satisfying for us and for the donor. Now I think the donors are expecting from us that our ideas get really into the world. And from their point of view, we hear that they are willing to take the risk that maybe in the past they were not taking. So I think it's really a changing that we are living, and we have to adapt. We will probably make some mistakes, but I think that our chances for success will be much improved.
And by the way, Stan's also a good example. He's a scientist. He developed sprinkles. It's gone to scale, and it's had huge nutritional impact. So I think, Stan, you're answering your own question. Would also be helpful at some point, but thank you for it. Maybe I just did answer your own. Anyway, we got a couple of other questions on the docket. There was one, Rebecca from Gus, who's the leading immunologist, if I may say, in Australia, a scientific icon in the world of vaccines, and he's asking about the cycle time of science compared to the cycle time of designing and spending out advanced market commitments.
Yes. Well, I was hoping we'd run out of time before we got to that question
because
that hits the nail on the head of a key question. We ask ourselves as donors really a dilemma, and that is about picking winners, and to what degree can we, sitting in Ottawa or sitting in DC, actually pick the winners. And so we have this challenge, whether it's push or pull funding. Within that spectrum, what we need to look at is the state of existing technology, and then define to what extent can we create the boundaries or the goalposts. And so in the case of the vaccine pull mechanism, we were not having to pick the institutions that we thought were going to come up with the new technology. We were not having to pick the specific corporations, but ultimately there was a trade-off in having to pick the specific strains of pneumococcal that we were going to award. Otherwise, it would have been too difficult to design a mechanism that anybody would respond to. So it was a trade-off, but then I go back to my earlier statement about that there is no panacea, and so it sounds like I'm not familiar with the technology that you're speaking about, but it does sound somewhat of a disruptive or transformative technology, and so we need other mechanisms, other ways to fund, including the Grand Challenge approach. And so certainly the AMC vaccine was one example, and yes, $1.5 billion is a big amount, but in sort of the vaccine world, it's actually relatively small, the amount that go through organizations like Gavi. So I think we just need to, to use the multiple approaches and accept that we are, making trade-offs in design of each of these initiatives.
And what I've learned from you, Rebecca, and from others, and the part I'd like to reinforce in the discussion with Gus, and I thought it was an excellent question, is you really framed it as innovation, financial innovation and experimentation, just like on the scientific side, we're innovating and experimenting. So, we wouldn't expect any one result in science to last for 5-10 years. Same way, we ought to think about these as experiments and innovations, and if we bring them together, we'll reach the impact. And I see Gus is nodding. So you said that. I'm just amplifying a point that you made. Toby, there was a question there about mining companies, a copper mine in Zambia, and I know from Alan's experience, he's actually asking this question from the standpoint of an opportunity, because we've had a chance to talk about this, and I know he sees those as potential platforms for health improvement and maybe even health innovation. So you may want to talk about your experience with that.
Sure. I think in general, the question that was asked is exactly the question we ask ourselves. So what is the role for a donor agency in trying to improve and build the state's capacity to take the benefits of natural resources and ensure that their population reaps them? And so one way we've done that at CETA, we actually just announced last month a $25 million funding for an extractives institute, which is going to be housed at UBC and Simon Fraser. And that's going to be a place that does exactly the type of thing I'm talking about. It's going to help build training packages and provide assistance to really help developing countries build that infrastructure, the public financial management, the institutions to manage what are often windfall profits from the concessions. So I really think it's about helping the country. It's not necessarily, yes, you can do small projects, but ultimately you want to increase the state's capacity to manage that. We also did announce, however, last year that we're working in partnership arrangements with specific mining companies and non-governmental organizations to work on different aspects on economic growth. So it could be skills training, it could be in the health area, but really trying to leverage private sector resources towards development and towards sustainable economic growth.
Great.
So those are just a couple of the examples.
Terrific. And just to bring that back home to the people in the room, think about what Norway's done with its oil wealth and its developmental spending. Think about what Alberta did historically with its wealth and actually putting it into foundations that support innovation. So there's even a cycling possibility there in terms of creating the future. So let me just stop because we're at time. I hope that you feel that this conversation has not been disconnected from your core interests. I hope that what you feel as an innovator in the room, that you have an innovation. We know that you're creative. We know that you're innovative. That's why most people in the room. And we know that almost everyone in the room is trying to solve a problem and take that innovation to scale sustainably because you want to have impact. It's not a theoretical exercise for most people, and I understand that. And I hope that the way you see this conversation that we've just had is starting to peel back the issues that need to be peeled back, whether it be a concrete example and how an innovation works with a company, whether it be the business development piece in the middle, which business is almost the wrong word. It's using the business ideas to take the path to scale, whether it's flipping onto the financial side, push, pull, the role of various sectors. I hope you feel that the conversation has been geared to you, and I hope you've been thinking about how your innovation can go on a path to scale, and I hope you've picked up the actual resources that you can use along the way as we all learn. We've put a lot more attention, to be honest, and Gus, this comes to your point, onto the scientific innovation side than the scaling innovation side. And we probably need both to get to where we want, to get to the world we want, with fewer maternal deaths, fewer child deaths, etc. So I hope you see it that way, and on your behalf, I'd just really like to thank all the panelists. I think you've been remarkably honest, insightful, thoughtful, and really, to my way of thinking, provided an interesting and important offering to everybody in the room. So thank you all very much.